Okay, so there's two issues in December. Hopefully, what I'm thinking is the majority of you are on this side, which is your schedule is full. You are, I know in Scripps Rock Dental, I was just talking to them about the schedule at my old office, and they're booked solid for the month of December. So they're trying to find room to get new patients in, to get patients back into the schedule. So I have, my terminology is shake your flakes. And there's a video specifically on shaking the flakes and front office rock. So search for it on the website and look for shake the flakes, or search the word flakes, and have all your team members watch this. Because specifically what this is about is, we all know there's people in the schedule right now who put their appointment in the schedule 6 months ago, who we're like 50-50 that they're going to show up. You know, they're the ones that cancel last minute. They're the ones that forget that they had vacation time, or they always have a money issue or whatever. I would rather shake those people out of December and put them into February or March, where it doesn't hurt our schedule as much if they fail on us. Not that we want a lot of people that fail, but I would rather shake them out of December and have room for people that are really trying to get in. So a couple of besides watching the video, but a couple of the things I would consider when you're looking at these patients is, have you seen this patient on a regular basis? Have they been in this year for regular maintenance? Reactivation patients, the ones who have disappeared for a while, are not great patients to book in the month of December. These are patients who, a reactivated patient, of course, we want to get them back, but there's a higher chance that they're going to fail. There's a higher chance that they're not going to show up. So do not reactivate, if possible, patients in the schedule unless you know they're going to show up. So have they been in this year for regular maintenance? How's their attitude towards your office and the importance of showing up for appointments? You know, we have those patients who are like, yeah, I'll get there if I can. Yeah, I'll try to be there. Those patients shouldn't get a month of December appointment. If they're kind of the ones that show up when they want, maybe it depends on how busy they are, then get them into another month and save this appointment for patients who really can be there. And then lastly, it's, have they done anything that you've recommended for them this year? Do they have a huge treatment plan and they haven't done a thing and they just come in for cleanings, and a lot of times they're late and sometimes they fail? Then these are flakes. And so what I would do is just watch the video and get on the phone with them and just super double, triple verify with these patients they're going to show up. And if they're not showing up, or if you've got any hesitation, get them out, move them into January, February, so that you have appointments available for people who really want to get in and use their insurance. Okay. Next is, if you have one of these, we had this issue yesterday. My daughter is actually a dental assistant at the dental office, and she told me yesterday it doesn't rain much in California, in San Diego. And we got a lot of rain yesterday, and we got all of these, oh, I can't make it because it's raining. Now, the rest of you are probably laughing because it's snowing everywhere else in the world. But when it rains in San Diego, it's like snow. And a lot of people called and canceled their schedule, or canceled their appointment. What I would say in the month of December is, if you get a last minute cancellation, I would be like, you know what? I'm sorry, we're booked solid for December, maybe even January, depending on how busy your January is. We're going to need to reschedule you in February or March. Don't let the flakes, the regular reschedulers, keep rescheduling in December. Move them out into February, March. If they really don't want that, guess what? They're going to find a way to show up to your appointment. Again, we've been too easy on these patients, and we really need to run control of our schedule, especially in the month of December, because there's nothing worse than sitting around with an opening in your schedule when you know you have a list of people who wanted to get in.